We live in an era dominated by medications, which can both aid and harm us. As we grow older, our kidney function naturally declines, making it vital to limit exposure to excessive chemicals and medications. This is particularly challenging because aging typically introduces various health problems, often requiring increased medication use. It's important to balance the need for these medications with the potential risks they pose, especially to kidney health, by choosing treatments carefully and under medical guidance to minimize harm while addressing health issues. Certain medications are nephrotoxic, meaning they can cause direct or indirect harm to the kidneys. This results in diminished kidney ability to filter blood, leading to the buildup of harmful waste and serious health issues. Kidney damage severity is measured in stages ranging from mild dysfunction to complete failure. The risk of kidney damage from drugs or drug-induced nephrotoxicity increases as you age, and if you have kidney conditions. There are two main types of kidney damage: dose-dependent toxicity and idiosyncratic toxicity. Dose-dependent toxicity means that damage increases with higher doses. In contrast, idiosyncratic toxicity is unpredictable and varies greatly between people. Sometimes it's best to avoid these drugs altogether. In this video, we'll explore the impact of common medications on kidney health and provide practical tips for managing these drugs safely. Remember, understanding the risks associated with them can empower you to make informed decisions about your health care. 1. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs, such as ibuprofen and naproxen, are widely used over-the-counter medications for treating pain, headaches, and inflammation. Millions of people use these drugs daily. However, they can also pose risks to kidney health. These drugs work by inhibiting specific enzymes in the body, which can reduce blood flow to the kidneys. This decreased blood flow can impair kidney function over time. With chronic use, NSAIDs can significantly reduce the kidney's ability to filter waste from the blood. This can lead to acute kidney injury, where the kidneys suddenly stop functioning properly, or even chronic kidney disease, where kidney function declines gradually over time. It's important to use these medications cautiously and under a doctor's guidance to minimize risks to kidney health. 2. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, like omeprazole, are commonly prescribed to manage stomach acid and ulcers. Although they effectively reduce stomach acid, prolonged use of PPIs has been linked with serious kidney issues. Research indicates that long-term use can significantly increase the risk of developing kidney disease. Additionally, one of the severe side effects associated with these medications is acute interstitial nephritis, an inflammatory condition affecting the kidney tissues. This inflammation can severely impair kidney function, leading to notable declines in renal health. It's crucial for those using PPIs to be aware of these risks and to discuss potential alternatives or monitoring strategies with their healthcare provider to safeguard their kidney function. 3. ACE inhibitors. ACE inhibitors, such as lisinopril, are commonly prescribed to manage high blood pressure and protect the heart. However, they can have unintended effects on kidney function, particularly in certain patients. These medications can cause a buildup of potassium in the blood, known as hyperkalemia, which is potentially harmful to the kidneys. Additionally, ACE inhibitors can lead to an increase in serum creatinine levels, a marker indicating kidney damage. This risk is higher in patients with pre-existing kidney issues or those who are dehydrated. It's important for patients on ACE inhibitors to have their kidney function and potassium levels monitored regularly. 4. Antibiotics. Aminoglycosides are a class of antibiotics recognized for their potential to cause kidney toxicity. These powerful medications are typically reserved for treating severe infections due to their strong effectiveness against bacteria. However, their use carries a significant risk of acute kidney injury. This injury occurs because aminoglycosides can damage the internal structures of the kidneys, disrupting their ability to function properly. Although not commonly prescribed, when these drugs are used, It's crucial to monitor kidney function closely to manage and minimize potential damage. This careful oversight helps balance the need for treatment against the risk to kidney health. 5. Diuretics. Diuretics, often known as water pills, play a crucial role in eliminating excess fluid from the body. Drugs like furosemide are commonly used for this purpose. While effective, these diuretics can also cause dehydration by increasing urine production, which reduces blood flow to the kidneys. This reduction in blood flow can impair kidney function and, in certain situations, may lead to acute kidney failure. This risk is particularly heightened in individuals who already have compromised kidney health or other risk factors. It's essential for patients on diuretics to manage hydration carefully and monitor kidney function regularly to prevent potential damage. 6. Lithium. Lithium, a medication primarily used to treat bipolar disorder, has well-documented impacts on kidney health over long-term use. It can lead to chronic kidney disease and, in severe cases, escalate to kidney failure. This is due to lithium's tendency to accumulate in kidney tissues, disrupting their normal function and ability to filter blood effectively. Because of these risks, it is crucial for patients on lithium therapy to undergo regular kidney function tests. This monitoring helps in early detection of kidney impairment, allowing for timely interventions to mitigate potential long-lasting damage and manage the balance between mental health treatment and kidney health. 7. Chemotherapy drugs. Certain chemotherapy drugs, such as cisplatin, used in cancer treatment, are known for their nephrotoxic effects, meaning they can cause significant kidney damage. The impact on kidney function varies, but can be severe, leading to complications such as acute kidney injury or chronic kidney disease. Due to these potential adverse effects, it's crucial for patients receiving chemotherapy to have their kidney function monitored regularly. Regular testing allows for the timely detection and management of kidney damage, helping to balance effective cancer treatment with the preservation of kidney health and the overall well-being of the patient. 8. Contrast dyes used in imaging. Contrast dyes, commonly used in diagnostic imaging procedures like CT scans and MRIs, can pose risks to kidney health. These dyes can lead to contrast-induced nephropathy, CIN, a form of acute kidney injury that results in sudden kidney dysfunction. This condition is more likely to occur in individuals with pre-existing kidney problems or diabetes, where their kidneys are already vulnerable. The risk of CIN necessitates careful screening and preparation before using contrast dyes, including hydration and possibly adjusting medications. Monitoring kidney function closely before and after exposure to contrast dyes is essential to prevent and manage this serious complication. Symptoms of kidney failure might not be apparent initially, but as the condition worsens, signs such as decreased urine output, swelling in the legs, shortness of breath, and severe fatigue become more evident. If untreated, the consequences can be life-threatening. Let's ensure you remember these symptoms to know when to act. If you are taking any of the medications that have been discussed in this video, check your kidney function regularly using tests that include blood creatinine levels, glomerular filtration rate, GFR, and urine tests for protein. Proper hydration helps your kidneys clear sodium, urea, and toxins from the body, which can mitigate the impact of nephrotoxic drugs. Be aware of potential interactions between your prescriptions that could impact your kidney health. A healthy lifestyle can help you keep medication to a minimum. Try to eat a balanced diet with lean protein, fruits and vegetables, and exercise regularly to protect your kidneys from any damage. As we close, remember, this information isn't intended to scare you, but to inform and empower you. If you're taking any of these medications, consult your doctor, especially if you have a history of kidney disease or other risk factors. Early detection and proactive management can significantly reduce the risk of severe kidney damage.